Alright, we continue with the circulatory system now. So we're going to look at systemic circulation. So this is the flow of oxygenated blood from the left ventricle to all the cells of the body. So the flow of deoxygenated blood from the body back to the right atrium then in return. Pulmonary circulation is the top half of the circulatory system. So deoxygenated blood from the right ventricle to the lungs, and the flow of oxygenated blood from the lungs back to the left atrium. So a few terms that you're going to come across in your studies: cardiac output, which is the amount of blood in litres pumped by the heart in 1 minute. We have heart rate, which is the number of beats per minute. This is a good measure of how strong your heart is. And stroke volume, the amount of blood pumped every beat. And there's the equation at the bottom. If you want to work it out for yourself, go ahead. Good luck. It's just it's a equation that does work, but you're not going to need to learn that for your exam paper, just in case you're having kittens thinking about trying to work that out. So we're now looking at blood pressure, and this is the force of the blood pushing against the artery walls. It's measured in two phases: the systolic phase, or systole, which is the pressure of the exerted blood. The pressure of the blood exerted on the artery walls when the heart pumps or beats. And then we have the diastole or diastolic, which is the pressure exerted on the artery walls when the heart relaxes. So if you look at blood pressure, you'll see two numbers, ideally 120/80. The 120 would measure the systolic blood pressure, and the 80 would measure the diastolic blood pressure. We're now looking at circulatory system again and the blood pressure values. So a normal blood pressure would be 120/80 and borderline high or 140/90. If you get something like that, you need to just drop a letter to the person's GP explaining what you found. If you get anyone that has a 160/100, so that's either 160 or 100, it doesn't have to be both. That is an absolute contraindicator to exercise. They cannot exercise with that blood pressure, and you need to refer them immediately to their general practitioner. So, short and or immediate effects of exercise on the circulatory system. So, whilst you're doing exercise, you increase the depth of breathing from 2V to VC. You increase your breathing rate, you increase your heart rate, and you increase blood flow to the working muscles. Long-term effects are increased tidal volume due to breathing muscles becoming more efficient, so your diaphragm and your intercostals become better at breathing. Increased amounts of hemoglobin within the blood. You increase in stroke volume due to cardiac hypertrophy or the growth of the left ventricle, therefore your heart rate reduces. Increased capillarization, so more of these little one cell thick blood vessels, and increased number of mitochondrial cells in slow-twitch muscle fibers. So quite a lot of effects and benefits to be had from long-term exercise.